It is my great pleasure and honor to introduce our first keynote speaker, Dr. Melinda Estes, and she is President and Chief Executive Officer of St. Luke's Health System. She is also Chair-elect of American Hospital Association. Dr. Melinda came to St. Luke's Health System in year 2011 as President and Chief Executive Officer. She oversees a $2 billion non-for-profit faith-based integrated health system, which includes 16 hospitals and campuses, heart, neuroscience and cancer programs, home care and hospice, behavioral health care, and more than 100 physician practices and retail clinics and senior living communities. She is a board-certified neurologist and neuropathologist. Dr. Melinda held a variety of executive roles at the Cleveland Clinic, Florida, and immediately prior to coming to Kansas City, she served as president and CEO of Fletcher Allen Healthcare in Vermont. Dr. Melinda currently serves as chair-elect of American Hospital Association, a membership organization that represents 5,000 hospitals and healthcare systems in the United States. We are quite honored having Dr. Melinda with us in Oman, in Muscat. We hope you enjoy your stay with us. Dr. Melinda, the floor is yours. Thank you.
Well, good morning. Thank you all for being here today, and thank you so much for that kind introduction. I would first like to thank Dr. Bailstrand and the entire International Hospital Federation for inviting me to address this year's World Congress. It is an honor not only to represent St. Luke's Health System and the United States, but also to be among this distinguished group from a variety of backgrounds, cultures, and professional experiences. And over the course of these 4 days, as we've met new colleagues and reconnected with old ones, we're reminded of the importance of the issues we discuss here and the challenges that we strive to meet. Not only does the IHF work tirelessly to build a world of healthy communities served by well-managed hospitals and health systems, it also brings us together right here in this respected global city so that we can share our knowledge, focus and expand our expertise, and work to overcome challenges, to save and improve lives for our patients and for all patients, so that we can truly serve, as this year's theme reminds us, people at the heart of health services in peace and crisis. That is the goal. In their collaborative 2016 bestseller, The Book of Joy, His Holiness the Dalai Lama and Archbishop Desmond Tutu spent 1 week with author Douglas Abrams discussing how to obtain true joy in a changing and often chaotic world. And through their conversations, one theme emerged time and again. True and profound joy is found when your focus is not on yourself, but on others. When you live with compassion and in service of others, joy comes naturally. Turn the focus inward, and that's when it becomes elusive, a constant struggle, and unattainable ambition. Growing up the daughter of a psychologist and a career military officer in the United States Army, I was raised on the value of service to others, of giving yourself over for a greater cause that you believe in. And my father would be proud to see that throughout my professional life, those lessons stuck. I started my career as a practicing neurologist and neuropathologist before I transitioned to physician executive leadership. And I have spent my career in service to the health of others with great joy. I know that so many of you join me in feeling that way. That's why we continue to give and innovate, to push the boundaries of care, to help more and do more. Back home in Kansas City, Missouri, located in the middle of the country, we at the St. Luke's Health System are striving to live out that mission, not only through our efforts to provide exceptional health care, but also in the way we fuel the economic engine that powers our region of the country, in the way we provide challenging and rewarding careers in healthcare, the way we create more jobs in other fields, and the way we contribute to the prosperity and stability of our patients and our neighbors alike. There is tremendous honor in that responsibility, and it brings tremendous joy. We here in this room represent a true global community, one where we tackle the world's most challenging and complex health threats, whether that's a full-scale crisis like an outbreak of Ebola that spreads rapidly through a town, a country, or the world, or natural disasters such as last year's tsunami in Indonesia, a 6.4 earthquake in the Philippines, massive flooding in countries like India, Spain, and the United Kingdom, or massively destructive tornadoes where I live in the U.S. Midwest. It does not matter where on the globe we are located. We know that our daily work at the local level is making a difference that ripples from community to community, country to country, continent to continent. Together, we share the goal of effecting positive change where we live, both in the health of our neighbors and in the local economy we actively support and often lead. In the United States today, there are more than 5,000 hospitals serving our population of more than 327 million people. Big and small, urban and rural, comprehensive and specialized. From the bustling streets of New York City's island of Manhattan to the expansive farmlands of Manhattan, Kansas, just about 100 miles from where I live. Whatever they look like, each hospital has a sizable economic impact on the cities and towns they serve, and on the economies that keep those cities thriving and growing. Hospitals and health systems contribute roughly $1 trillion to the U.S. economy each year. They are major employers, creating and providing more than 6 million full and part-time jobs across the U.S. And those numbers are growing. When you consider that 25 years ago, that 6 million was 4.3 million. That's an increase of 42% in a quarter century. And the ripple effects created by hospitals, which benefit the economy through employment and commerce, are today creating even greater and longer-lasting value for their local communities. Each hospital job supports nearly 3 additional jobs in diverse industries, and every dollar spent by a hospital supports more than $2 of additional business activity. That's a total of 17 million jobs across the United States and more than $3 trillion of economic impact. With so much at stake, it's important that we, as providers and caretakers, align our efforts, striving to always create an effective, efficient, and ethical system for delivering care, the way our patients expect and deserve. Over time, we've found the best way to care for and protect our providers and patients is by advocating to our lawmakers for the issues that really matter, by supporting legislation that will affect the right kind of change, and by always speaking with a singular voice. The American Hospital Association is that voice. Formed 120 years ago to ensure that the hospital leaders of the day were intimately involved in the national discussions on health care, the AHA's mission has always been simple: to advance the health of individuals and communities. With a respected and responsible hand, the AHA is the constant advocate for more than 5,000 member hospitals on the most critical issues facing U.S. healthcare today. It keeps the lines of communication open, with government agencies and elected officials, telling our stories, sharing our data, promoting our policy, and striving to improve care. From the creation of Medicare in the 1960s, which helped provide health insurance coverage to Americans over the age of 65, something a startling 40% lacked at the time, to the passage of President Barack Obama's signature legislation, the Affordable Care Act, or Obamacare, which has since decreased the number of uninsured Americans by 20 million. The AHA is proud to have been at the forefront of many critical initiatives that have helped provide more, better, and easier to access care to our fellow citizens, residents, and immigrants alike. On January 1st next year, I will have the privilege of beginning my year as chair of the AHA Board of Trustees, a role I will assume from my colleague Brian Granulotti, who is here with us today and who has served this past year with distinction. It is a profound honor, and it comes at a time when I believe my own calling to serve others will be at its most valuable. We believe, the role of the AHA is to first and foremost ensure that when our neighbors become our patients, our hospitals are safeguarding the trust placed in our hands and always acting in their best interest to care for the patient first and always. At St. Luke's, we often speak of this as a culture of kindness. In a complicated climate filled with division, anger, and anxiety, we have chosen to celebrate the kindness we see in our hospitals and among our teams, for our patients and for each other. We hear stories throughout our health system of acts of kindness and selfless service. We hear of quiet moments of humanity displayed and the grateful moments of compassionate care received. Like the team member who is now a St. Luke's nurse because she was inspired by the St. Luke's nurses who cared for her father in his final days. Or the security guard who stopped a heart attack and saved a life just because she was being herself, chatting with visitors in the parking lot, taking an extra step to check on everyone's well-being. Or the mother in our hospice care who in her final hours was able to watch her daughter graduate high school right there at her bedside because our team saw the opportunity to make a miracle happen, and then they did just that. These are the values and actions that inspire me, that help me see a path forward for this healthcare field we all share. I'm confident we can create the essential tools hospitals need in times of massive global change, but it requires working together toward a common mission and always with the patient at the center of every decision. This is how we serve at St. Luke's and how I believe we all strive to serve every day. St. Luke's is located in the Kansas City metropolitan area, which sits on the border between the states of Missouri and Kansas, right in the very center of the country. Together, the neighboring states of Kansas and Missouri have a total of 267 hospitals, employing 248,000 people. That ripple effect means these jobs directly lead to another 341,000 jobs in wholesale, professional services, insurance, construction, and a host of other related fields. As a result, Missouri and Kansas hospitals alone contribute more than $41 billion to our state's economies, including $29 billion in direct and indirect wages. But to me, and to our team, we believe our ultimate purpose is not to drive revenue. It's to provide exceptional care to our neighbors. And it's what we have proudly done for nearly 150 years. Within a few hundred miles of our 18 St. Luke's hospitals and campuses are the historic homes of U.S. Presidents Dwight D. Eisenhower and Harry S. Truman, of Mark Twain, and Old West outlaw Jesse James. It's where the first shots of the American Civil War rang out, and where President Lincoln's intercontinental railroads intersected, connecting the established East and the rapidly expanding West of the 19th century. Recognizing where we are gathered today in a city whose history dates back 2,500 years, it seems odd to talk of our early roots in the 1830s, but there in the middle of America's westward expansion is where St. Luke's was born. In 1882, with the help of the Episcopal Church, the small frontier hospital that would one day become our flagship facility opened its doors to serve the 55,000 people living in Kansas City. With both its central location and its vast and fertile land, Kansas City grew rapidly, and today encompasses 270,000 square kilometers and is home to nearly 2.5 million people. And for all these years, St. Luke's has served it all. Operating as one integrated health system, we deliver care with the same deliberation and expertise at every one of our facilities. At our 4 world-class institutes, specializing in cardiac care, neurosciences, cancer care, and rehabilitation, and in the more than 100 clinics and physician practices that cover the area. Our flagship hospital is ranked in the top 50 hospitals in the United States for cardiology and heart surgery, as well as for neurology and neurosurgery. And St. Luke's is proud today to remain the only faith-based, locally owned, not-for-profit system in the area. And we are an economic engine. As the 4th largest non-governmental employer in Kansas City, with more than 12,000 professional employees, including 800 employed physicians, specializing in dozens of fields, we want our community to thrive. We invest in innovation, new technology, and new models of care. Always at the center of our decision-making are the immediate and lasting benefits of that investment. Our population health initiatives are working to lift up the community so that more people can fully participate in and benefit from the healthy and growing local economy. That means knowing our patients intimately, knowing their histories, understanding how they live their lives, and empathizing with the challenges they face when trying to live their healthiest lives. This means truly knowing the populations that we serve. In 2015, I visited Cuba as part of a medical delegation with the goal to better understand the Cuban health system, how it differed from our own, and what knowledge we might gain from it. During our visit, we called on a local family physician whose office was located where she lived inside an apartment building. It was a small 2-room office where she treated most of the residents in the building. They would stop to see her for checkups, illnesses, and injuries. And often this physician would conduct family house calls, visiting those with chronic conditions, investigating symptoms, investigating risk factors, building lasting relationships with her patients, and providing true population health care. When I walked into her office, I saw all of her charts on just a couple of bookshelves. Physical paper charts, not a laptop, iPad, or digital device in sight, just bookshelves, bursting with beige file folders, each chart with its own array of brightly colored tabs poking out from its end. I turned to ask her what the tabs meant as we conducted rounds on her patients. She picked up a chart and said, "This patient has heart disease, red tab." She picked up another. "This one has diabetes, green tab, and this one, COPD, blue tab. By simply picking up each chart, she was able to easily identify each of her patients' individual health needs, and just by glancing at the bookcases, she saw the health trends affecting her entire community. There's something, I think, to be said for that kind of personal human-to-human connection and knowledge. And in the United States, it's a model of care that I'm pleased to see that we are slowly returning to. It's easy to see, after decades of rapid innovation and engineering miracles, rapid advancements in technology have helped us to better save and prolong lives. But too often, our full embrace of technology has meant a disconnect between patient and provider. With population health, however, reconnection is one of the positive outcomes. We in the United States are reconnecting to our patients, something much of the world has practiced day in, day out, decade after decade, century after century. To me, it's a reminder that we are serving in the same mission and have been for a very long time. Of course, we should not forget the very real benefits of technological advancements. What we are learning right now is that it is all about balance. Until very recently, most of U.S. healthcare was operating an analog model in a digital world. For decades, while consumers were rapidly growing, not only accustomed to, but becoming more reliant on digital advancements, hospitals were moving at a, let's say, more deliberate pace. More and more, the everyday events of life have become customized and specialized, fitting neatly into each person's specific life and lifestyle just the way they want it, from rideshare services like Uber to streaming TV. The question soon became, can my healthcare provider give me the same kind of convenience and transparency? Too often, the answer was no. But St. Luke's has made a commitment to raise the bar. Together, our board leadership team, physicians, and entire organization have committed to innovation as the driver in meeting the needs of our digitally minded and convenience-seeking patient population. We knew that it would be possible to meet those evolving needs through innovation, not only attracting new patients to our hospitals and practices, but also deepening our relationships with existing ones. We created mobile apps to give them 24/7 access to providers with virtual visits, the ability to manage their records, pay bills, make appointments, and even find their way around our hospitals, which I think worldwide is a problem we all share. We placed walk-in clinics inside neighborhood grocery stores so they could manage their preventative and minor care needs right where they already were, spending their time living their lives. And we implemented an integrated electronic medical record that connects our entire health system. So no matter which facility a patient is in, their records will be there, showing everything from their family history to their next scheduled appointment to the reminder about the flu shot they still need to get. It's all there in one seamless patient experience. In the 15 years spent creating these technologies and building this infrastructure, St. Luke's has invested capital of more than $2 billion back into our Missouri and Kansas facilities, programs, and services. And that's what it is, an investment. Because our patients notice when the care is faster, easier, closer, and more compassionate, and when that care is delivered with excellence, they appreciate it even more. There is no doubt about it the U.S. healthcare field, and specifically the hospitals providing that care, have a significant impact on our economy, both through employment and investments in technology, job creation, innovation, and construction. But as a faith-based system, it's not just about dollars and cents to us. It's about the way we treat our patients, both in our exam rooms and in our neighboring communities. We take that care out into our surrounding streets, homes, and churches. We discuss healthy eating with school kids and end-of-life planning with seniors. We provide preventative screenings to keep them healthy, and we provide free charitable care when they can't pay. In 2018 alone, St. Luke's invested more than $135 million back into our community through charity care, community service, social work, outreach, and other programs that benefit local residents. We do this because as a member of this city for nearly 150 years, and as Kansas City's leading healthcare provider, we firmly believe that it is our responsibility. To help on a larger scale, we are focused on better understanding the social determinants of health so that we might improve on them. Currently, we're studying transportation, food insecurity, and economic inequalities, all factors affecting how healthy a person is and how they receive care when they are not. Population health centers around the idea that we can reduce the cost of health care for our entire population if everyone were healthy. A simple idea, a very hard construct. For us, that means broadening our focus on not just treating the sick, but also on nurturing the healthy and helping everyone cultivate a healthier lifestyle. We do this not just with medicine and treatments, but also with the fundamental essentials, like a ride to the doctor, or a refrigerator filled with enough healthy food to last a week, a challenge for nearly 20% of the people we serve in our urban core. Using our electronic record management system, much like that family physician in Cuba, we're learning more about the health trends of our neighbors. We are now screening every patient in our care to better learn about their food and transportation security and how it affects their health and how we can help make it better. Because without the essentials of food and transportation, it's difficult for a single mother to keep her family healthy. And when they do get sick, how does she get them to the care that they need? These questions are the first step on the path to understanding the current situation. From there, we get to work on the solutions. Partnerships with local food banks, other faith-based organizations, and rideshare services like Uber. E-health technology that will bring care directly to the patient's living room, and programs that keep families healthy, making care accessible and making them all stronger. This is the role hospitals play. We no longer just treat the illness, we treat the conditions, the lifestyles, and the societal roadblocks that cause the illness in the first place. Because while many diseases that used to be death sentences are now manageable conditions, we instead have new problems to face. Today, the social determinants of health are a growing focus, not just in Kansas City, but throughout the country. And it will take all of us working together to make the progress that still needs to be made. Because at the end of the day, what we do is a privilege. It is a profound honor to care for people at their most vulnerable, at their most desperate moments, and in their most joyous experiences. They put their lives in our hands, and they trust us not only with the care, but with that of their loved ones as well. It is a responsibility that I know everyone in this room takes seriously. And how we each came to be here today is our own story, each unique and valuable. Every organization represented here was created for a purpose, for a singular purpose. We all know care today is far more complex, but the personal connection, the commitment to our home, the dedication to our patients has not changed. Nor has our promise to safeguard their personal prosperity by fueling our local economy with jobs, advancements in technology, new models of care, and investments in our total population's health. Our patients, our nurses, our physicians, and our staff, our volunteers, executives, and boards of directors, all of us, we the collective. Each and every one of us is affected by our mission of service and our commitment to delivering care with compassion. As either a giver or a receiver, or sometimes both, it has touched us. And in an environment dedicated to making people's lives better, we know service is the cornerstone, just as hospitals are cornerstones of their communities. As His Holiness the Dalai Lama said in discussing the virtues of compassion in the quest for true joy, the more time you spend thinking about yourself, the more suffering you will experience. The incredible thing is that when we think of alleviating other people's suffering, our own suffering is reduced. This is the secret to happiness. This is the reward we find in the work we do. The joy of helping our neighbors, simply because we have the skills, the knowledge, the technology, and the resources to do so. Because their well-being is what we have built our passions and our careers on. And because we know that together we can alleviate suffering, create wellness, drive prosperity, and promote health on a global scale. That is the promise. Thank you.